Yes, sir. So this next question does say, I had my upper wisdom teeth removed when I was 21 with no pain or complications. My lower wisdom teeth were impacted, requiring an oral surgeon and a ride home. I followed all instructions but still got a dry socket, and which was quickly treated. 30 years later, I broke tooth number 14 while eating a frozen Snickers bar. After starting antibiotics, I had it extracted despite using ice packs, ibuprofen, and saltwater rinses. I'm still in pain 3 days later. My left sinuses are acting up, and there's a strange drainage from the socket, possibly pus. I have dissolving sutures and am on a second round of antibiotics until my follow up. I've been careful, no straws, no spitting, and strenuous activities. I stick to soft foods, chew on the other side, avoid hot and carbonated drinks, and apply clove oil to the gum above the socket. As a nurse, I'm familiar with the healing process. Any advice on this stuff?
Man, what a wonderful narration, right? It's
Yes,
almost like
yes,
a
very
story,
detailed.
very detailed. No wonder you are a nurse, right? And
Yeah.
so you are in the business of helping patients. And thank
Mm-hmm.
you so much for telling
Yes.
the world what all the things that you can expect. Please listen to her question. Whatever Emily said carefully, she wrote a narrative, right? A
Mm-hmm.
complete narrative.
Mm-hmm.
So the long question short, and she had some previous oral surgery done. She did fine, but now she had an upper left tooth extracted, which we call it
Mm-hmm.
as a number 14, and she's having some issues with some pus coming out of that area,
Mm-hmm.
and she's on a second round of antibiotics. So what we call it as an oral antral communication, what means like oral, which is this, antral means like antrum maxilla right here, which is the sinus here. What she is possibly experiencing is an oral antral communications. If you remember, that's a class we were
Oh,
teaching the dentist last
yeah.
month.
Yep. Yes,
So
sir.
what she has is an oral
And the
possible.
sinuses.
Exactly
Mm-hmm.
right. So what she possibly has is an oral antral communication, which is taking some time to heal, and sounds like the dentist has already put her on the second round of antibiotics. And bingo, 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 she already said she's taking all the precautions. No
Mm-hmm.
straws, spitting, no strenuous activities, and she's sticking with soft diet, and she's chewing on the other side, avoiding hot and carbonated drinks, and everything perfect. She has to do everything. The only thing that I would recommend that you change is, you said applying clove oil on the gum above the socket. I would not recommend
Mm-mm.
doing so. Whenever the sinus is healing, I call it as a baby tissue. So whenever you have the communication, the baby tissue or the baby gums are trying to close, then you put oil, then they break open.
Mm.
They start to close again. You put clove oil, because of the irritation, they will break open again. So I would recommend you do not put the clove oil. In addition to all the things that you already said, few other things that I would highly recommend, which I normally tell all my patients every single time, is don't blow your nose. If you're going to blow your nose, particularly on the side you had the procedure done, it is going to again break the baby gum tissue open. And same thing, when you sneeze, let it go. People have a tendency to hold it. When you hold it, then it's just going to increase the pressure on the sinus, and it is just going to break the baby gum tissue open. So don't blow your nose, don't sneeze, let it go when you sneeze. And do not bend over. When you bend over, you put a lot of pressure. Now the pressure wants to escape. So do not bend over. So when you have to do pick up something, then just sit down. Sit down straight, and then come back up straight. And do
Mm-hmm.
not fly. When you fly, when you're going to build a lot of pressure inside the sinus, and then that is just going to again break the gum tissue open. As you said, no straws, no spitting, no strenuous activities, soft diet, chew on the other side, and do not apply the clove oil.
Yeah. Perfect.
Yeah,
I
and
actually didn't know about the flying.